My name is Joanna Sowers. I'm from Rhinebeck, New York, and I graduated from Rhinebeck High School and went to Cornell University. I went to ELAM and I graduated in 2014 with that graduating class. I'm now here in New Mexico because I did my residency program at the UNM Santa Fe Rural Family Medicine program. I'm now doing my fellowship in rural family medicine, working in Santa Rosa, New Mexico, and at UNM doing more training in emergency and intensive care. And I plan to work in rural New Mexico once I graduate. I'm grateful for my education in Cuba because I think it prepared me for the challenges working in rural communities. I learned Spanish and I'm fluent in medical Spanish, which helps me work with the communities of New Mexico, predominantly the Spanish-speaking population. And I think it gave us a wealth of knowledge in terms of understanding public health and the determinants of health in our communities. And so I'm grateful for that. And I'm grateful to the Cuban government and the people of Cuba for giving me that opportunity and this education. And my dream as a doctor is to continue to provide rural communities with quality health and to provide health as right and not a privilege. Gracias al pueblo de Cuba para esa oportunidad.
So we're a public institution with a public trust, University of New Mexico. And I've always felt that we have to be driven not by our interests, by the community's interest. And when you get to workforce, it's very important because it's a relatively poor state, and one of the biggest employers is the health system. And whereas even in hard times, where other sectors are losing employees, the health sector keeps increasing. And part of that is because we're getting older and the population is increasing, but also because of insurance and Obamacare. So with the Affordable Care Act, now more people have insurance than there's a need for it. So then the question is, well, where's the workforce? The workforce has evolved in the United States in a different way because we were really private business. And that meant that when major federal funds came in for research and the development of teaching community health center or teaching hospitals, they looked at how do you train a workforce that would meet the needs of those teaching hospitals. But that's not the same as what is the workforce needed in communities. So if you look at our rural communities, underserved communities, urban and rural, often there's a high turnover. The income is lower, people are paying off debts, or they're in national service, and when that service is completed, they may leave. So many communities say, we'd like to grow our own. What is the role of a public university in helping that? And there are many steps. One of them is to attract students from those underserved areas, rural and urban. It's to attract students that look like the community served, so there has to be an ethnic distribution. And New Mexico is a minority state. So the United States is going to look like us in 40 years. So how do you recruit from rural and underserved areas with an ethnic mix like our state? It's easy to say, very hard to do, because we have admissions requirements which look at test scores. Well, if you're from an underserved community or come from a poor family, you don't have the resources to have taken lots of AP classes, lots of other, or coming from a rural community where there aren't many teachers, or there's no access to the kinds of support services for tutoring and other things. So you have to almost change the admissions policy. You have to change how you value things that we traditionally value may not be as important when you're looking at the health needs of a community. So when we looked at ELAM, it was a little different because there they started with students from very underserved areas that kind of reflected the ethnic distribution that we need in our state. So it seemed like a very good match. The other is they seem to have a commitment to social need and social justice, which has a huge implication in terms of how does a graduating physician choose to practice, what are the values they have to make them make a choice as to where they're going to practice and what kind of practice they're going to have. So those were all the ingredients that made a match between our interest in the residency in family medicine, and the graduates of ELAM. So now how do we translate that interest in what seemed like a good fit between ELAM and our residency? And there were a couple of hurdles because we are not allowed to take residents at the University of New Mexico who are unable after graduation to practice in the state. And for that reason, ELAM had to be approved by the screening list that was developed in California. So we wanted to take students, but we were held back. And one of the students who worked on that was one of the first students we took. She successfully got that approved through the list, that is, ELAM is in the list, so therefore we were able to take, and she was the one we took first, Carmen Landau. So that's how we kind of got in the game. We were able to take the students. These students are highly motivated, very community committed, and if you look, I think we've taken about 5 by now. All of them have decided to stay in New Mexico, work in underserved areas, so they totally fulfilled our interests. Their training, it's interesting because I've been back and forth to Cuba a number of times, visiting ELAM each time and talking to students about our program and learning about them. One of their concerns was they're not trained in the same technology that we have in the United States and worried that they wouldn't be skillful enough. On the other hand, they're highly skilled in working with communities, which is something we wanted. 2 things happened. One, when they were admitted, what they realized is within a couple of months you learn all the technology. That's not really the barrier. They fear that, but that's really not the big issue. The second is one of our residents, or maybe 2 of them, went back to Cuba where they had trained and gave orientations to the ELAM students about fitting into a U.S. residency. So that's then the question is, how is it working for us to have these ELAM students who are now our residents? Works great. We keep taking at least 1, if not 2 a year, and I've interviewed most of them, and I've worked with all of them because we work on the wards and the clinics and the communities, so I see them all. And they fit in very well. They enrich our residency. We have 4 residencies in the state. This is the largest one in Albuquerque, but one of our very good partner ones in Santa Fe. And they took one of the students where they did the internship here the second 2 years in Santa Fe. And when she finished her residency, she's our first fellow in rural medicine. And we set it up around her because she was so exciting. She's doing everything. She's working all over the state. And she just gave a wonderful talk about her experience and how to develop a rural fellow. Tatiana Guerrero is one of our ELAM graduates, and she came from Albuquerque and Santa Fe, recruited locally to go to the ELAM school, and then she came back and was a wonderful resident. There's an irony here because my son is also a family doctor. He's the medical director of the large federally qualified health center. So she trained in that center for her continuity clinic, and then he recruited her, and so now she works there in probably the most underserved area of our city. So I see enormous value for a whole variety of reasons. The nature of the training, the background of the students who come, their commitment, and their moral commitment to doing this kind of work. I also think it's an issue of international role of our school. And it's not just that we share models with other countries, but other countries share models with us. And this is a very good example of that. In working with ELAM, we learn about different ways of educating students, and we learn from that. We're also a WHO collaborating center, that is the Office for Community Health, and this is one of our partners. We work all over. This is very unique. It's not like a school that has international medical graduates in that sense. This is U.S. graduates. Now, many times there's a bit of a concern about taking students, for example, residents from developing countries. And the reason is often we take those students and residents And we save a lot of money, and we get a benefit because of those. We save $450,000 for every doctor we don't have to train in the United States. But the donor country, mostly from developing countries, loses $150,000 that they put into the training of that doctor that they've lost to us. It's a subsidy of the wealthy from the poor. ELAM is a little different. These are American students. They come from the United States. They're getting a different learning experience, and we're getting them back. It's not like a Caribbean school, even though it's in the Caribbean. It's a totally different kind of program. The Caribbean schools can be very good, but they're very expensive. They're all private. And those schools really, because of the cost, often have to take students that have much, much higher income. That's not ELAM. ELAM are usually students who don't have that high income. And so in many ways, it's totally different from other schools, but it's very attractive because of the nature of the students, their background, and their orientation, not like any other school. So one of the historical points that was important about the forming of ELAM is when Hurricane Mitch devastated Central America. And when Cuban doctors were going abroad, and they saw that there were many doctors in these countries, but they weren't working in underserved areas. And one of the issues was they don't have to be having all these Cuban doctors there if their own doctors would serve locally. And I think that's a lesson that we should learn here. You know, sometimes we import lots of things, but we have the resources here. We have to think about using those resources in a different way.
My name is Tatiana Guerrero Pezzano. I'm from Albuquerque, New Mexico, and I graduated from ELAM in 2010. So right now I'm practicing in family medicine at a federally qualified community health center. And one of the reasons, or one of the ways that ELAM prepared me for this is the type of medicine we practice. It's generalist, it's high yield. I learned in medical school in Spanish, and a lot of my patients currently are Spanish speaking only. They're low resources, and they come from community strata that have many social determinants of their health. So ELAM and the Cuban medical system, which is based primarily in primary care and public health as one, in and of itself prepared me for this type of work. The other thing is that because I have no medical school debt to pay back, I am with this federally qualified health center because I want to be. I don't have to seek out a private healthcare system in order to pay back $250,000 worth of loans. So my dream for medicine and for my practice is that I'm able to practice in a healthcare system in which primary care is the priority, and in which in and of itself primary care puts a focus upstream where we practice more preventative medicine and preventing chronic disease and chronic illness, so that we are costing the healthcare system and the community less money further downstream with emergency care visits, so that we have less morbidity. And ultimately, I would love to see the big drug companies and the big insurance companies out of the medical practice. Thank you to the Cuban government for giving us all this opportunity to practice and learn medicine, but practice our dreams, essentially.
My name is Carmen Landau, and I'm originally from Washington, D.C. I graduated from ELAM in 2007 and started residency at the University of New Mexico for family and community medicine in 2009 and finished that residency program in 2012. I've been working here at Southwestern Women's Options since I finished residency in 2012, so it's coming up on 7 years now. I work here with two other colleagues as an abortion provider, and we see patients in all trimesters for abortion care. When I think about what my dream job is, this is it. I've known since the very first day that I came here as a resident to do an elective that this is what I wanted to do with my life, and I imagine spending the rest of my career here. When I look back at my education at ELAM and think about how it prepared me to do this work, I think of the emphasis that was always placed on using our position as physicians to be leaders in demanding and advocating for health equity. And in working with women who are seeking abortion care, we see that oftentimes they have not received equitable care, partly because of the lack of access to abortion, but also so many things leading up to it, including contraception and social, political, and economic equality. And practicing this type of medicine really gives me the ability to provide people with equitable and justice-based healthcare. I am eternally grateful to the people of Cuba for providing me with the opportunity to become a physician. I don't think that it would have happened without that opportunity, and I am very fortunate, and I hope to repay humanity by continuing to do this important work, and I always will remember Cuba for that.